It was 7 weeks ago that we last saw Saskatchewan's Chief Medical Health Officer, and 1 week from now, kids head back to school in our province. The COVID-19 situation is very different from where it was back in July, and joining me now is the province's Chief Medical Health Officer, Dr. Saqib Shahab. Thanks for being here.
Yes, hello.
It's been a long time since we've talked. I have to admit, the first question I got from everyone when I mentioned I was doing this interview is, where has he been? So, where have you been since we saw you shake hands with the Premier back on July 7th?
Well, I think like many of us, we were thankful that things had slowed down, and I took a couple of weeks off in July, and obviously it was a beautiful summer and still is, and it was great to be off and, just enjoy the great outdoors. And it's been, I think, a nice summer for many of us, taking a bit of a break, but obviously now it's back to work.
Well, we know cases are now climbing again in Saskatchewan. What is your assessment of the current COVID-19 situation?
Yeah, I think it's a balance of things that are really positive and things that potentially can be very challenging. So, what's really positive, obviously, is the fact that, we have had a really high uptake of vaccines, especially in 60 and older. And because of that, thankfully, we are not seeing high rates of hospitalization and death in the most vulnerable. And even though we get occasional importations of cases in long-term care facilities, thankfully the vaccines are protecting the most vulnerable, and we're not seeing large outbreaks and hospitalizations and deaths. So I think that's the good news. The second good news is the vaccines are really effective in preventing serious illness. I know there's been some concern that you can still get mild illness. About 80% of our cases every day are in unvaccinated, about 20% are in partially vaccinated or fully vaccinated. But we have to remember, and the US has been looking at it closely, that if you're fully vaccinated, 60% of the time you will not get any illness, and 20% of the time you may be asymptomatic but may shed virus for a bit for a short period of time. And that's why really in indoor spaces, when you're with others in a crowded condition, people you don't normally work with, or your household or your close family, it's still a good idea to wear a mask in indoor settings, even if you're fully vaccinated. And 20% of people will generally get mild illness, even if you are older or have risk factors. The breakthrough rates suggest that usually you just get a mild illness, unless of course you have immune suppression or other comorbidities. But if you're unvaccinated, I think the virus is worse than what it was last year. And I think therein lies the challenge, that if you look at our vaccine uptake, 76% one dose, 67% two dose, with wide variation across age groups. 50 and older, 80% have taken one dose, and 74% have second dose, 50 to 59, but 83% or higher, 60 to 69, that's the number we need to chase. And our numbers for school-age children, 12 and older, are lower, and numbers for parents of those children are lower. So I think that's where it's back to school, yes, but I think anyone who's not vaccinated, fully vaccinated, is still, there's time to get vaccinated to protect yourself and those around you.
The Saskatchewan Medical Association, the Nurses Association, local medical health officers, they've all been asking for more restrictions, specifically indoor masking, since those cases have started surging. Minister Dustin Duncan told our Morning Edition host Stephanie Langenegger that it was a difference of opinion on the science. Why is your opinion different from the many medical professionals in our province?
So the science I just mentioned, that, the vaccines protect really well against serious illness, hospitalization and death. They protect well against becoming mildly ill or transmitting, but not to the same extent. It's about 60%. And that's why, many jurisdictions in May, June said, if you're unvaccinated, maybe you don't have to wear a mask. But now, with a rise in cases, it's a good idea that everyone, when they're in closed indoor spaces with others who they don't normally work with, at work or in other settings, it's a good idea to wear a mask. So that's very clear. In terms of how that should be implemented, is it a strong recommendation, which it is from me, or should it be similar to a mask mandate like it was before? I don't think Saskatchewan, the province is at a point where, it's going to implement a mask mandate, but certainly I think context is very important. So for example, if you work with 4 other people in an office environment or in a workplace and you're all comfortable, it's the same consistent 4 people, hopefully everyone's vaccinated, you can share indoor space without a mask. But, if you're in a bus, in a transit bus, you don't know who's vaccinated, who's not. Someone may be unwell, trying to seek medical care, see their physician. In those settings, it's a good idea for everyone to wear a mask. So it is a strong recommendation. Would it be a mandate? I think that, first of all, that needs, additional tools in terms of compliance and enforcement. But certainly at this point, it's a strong recommendation that in indoor places, crowded with people you're not, routinely in contact with, it's a good idea to wear masks. But having said that, we can do many things, even if as our case numbers are high. At these case numbers last year, we would have been in lockdown like last fall. We don't have to be in lockdown because, those of us who are vaccinated can meet each other in our houses, can have gatherings, and be confident that we will not get seriously ill for the most part. But, again, our hospital numbers are coming up around 100 with 15 in ICU. And that is, for the vast majority, are people who are unvaccinated. I think that's an ongoing challenge. And a lot of colleagues have said that people are surprised when, they're middle-aged and they end up in hospital because everyone thinks I'm healthy, it won't happen to me till it happens to you. And so that's why I think, we still have lots of vaccine. Before we get into the fall, I think it's critical that vaccine, uptake goes up. And a lot of colleagues are working with communities to do exactly just that.
I'm wondering, though, we get the same information as all the other provinces. We've seen BC, Manitoba, Quebec bring in different restrictions or rules. I'm wondering, with the Delta variant becoming such a dominant one in Saskatchewan, what will it take to reimpose any mandate or restrictions?
One thing, of course, is the pressure on the healthcare system. That has always been one of the, in a pandemic, that's always one thing that you want to protect. You want the healthcare system to be there for not just urgent care, but now that we're in 18th, 19th month of the pandemic, for routine care. You can't delay or defer routine care indefinitely. And the reality is for the most part, obviously, vaccinated people can sometimes require a hospital bed because of COVID. Children under 12, hospitalization rare, but they're not eligible for vaccination. But for the most part, every hospitalization right now due to COVID, in the vast majority of cases, 80% or higher, is preventable. And I think that's where the pressure is going to come. That if case numbers keep rising, again, urgent care will be delayed, elective care will be delayed. And if it comes to that, you can't get a bed, not just for COVID, but for other emergencies like, heart attacks, that would be one point you want to avoid getting into. But I also want to say that, healthcare providers are very frustrated and sad because whenever they look after a person who's unvaccinated in hospital, everyone feels that this is preventable, and so as do many patients and families of loved ones who end up in hospital. So, we've seen it again and again, and how there's regret once a person is hospitalized. So again, I would really urge friends and family to reach out to those who remain unvaccinated, to work with them. There may be many questions that now are easy to answer. Vaccines are extremely safe, extremely effective, and support people to get vaccinated. But hospitalization is one key indicator right now.
I know that there's concern about COVID in the hospitals, but we already know there are a number of people who urgently need surgery, who've had surgeries canceled, and numbers in hospital are climbing. So what's the breaking point? What's the number? Like, how do you decide when there needs to be restrictions? Because we're kind of already at that point where we're seeing people miss out on surgeries or procedures that they need for regular healthcare.
Yeah, so from a public health point of view, every hospitalization, or the vast majority of hospitalizations in vaccinated people, are preventable. So I would say we should not be seeing more than 20, 25 hospitalizations right now. But we could only have achieved that if we had 19% or higher vaccination rate that we are not at. Some provinces are becoming close to that. In terms of what's the capacity of the health authority, I think that's better spoken to by the Saskatchewan Health Authority. Obviously, um, they don't have vacant ICU beds or vacant hospital beds. They have to deploy additional beds initially, and then they have to slow down other services. But I will like to say that we came down to I think 30 to 40 people in hospital in June, July. We thought we would go down lower, but this increase of the last 2 to 3 weeks is very concerning. And a higher vaccination rate, which can happen very quickly. We can easily vaccinate another 15% within a week or two, first dose, and then second dose within 4 weeks. That can decrease hospitalizations by 50% or more. More consistent mask use in indoor places can decrease hospitalizations. So those two tools can make a big difference without, of course, having to go to all the restrictions we were so tired of till all the way till July. So I think those are two really important tools. Can we reach there with voluntary compliance? Does there need to be more local measures in parts of the province with case numbers are high, which right now they're much higher in the north, far north. Saskatoon is trending up. Regina and some of the southern rural areas are going up and down, but not so high. Or do we require stronger provincial mandate? I think is something that needs to be discussed in an ongoing fashion.
If you don't or won't have a province-wide mandate, why not let local medical health officers in, say, Regina or Saskatoon or the North make that decision for that region as needed?
So I think medical health officers can make a strong recommendation. I think for orders, it does need a provincial chief medical health officer order under the authority of the government and the health minister, which is similar in many other provinces. Like many other provinces, when there's a local order, some elements of that do need a provincial order. Like if you remember in the past, there were provincial restrictions, but then there were more specific restrictions initially for the North last year and then for Regina. So that still requires a provincial order because that is how the Public Health Act and regulations are written. But certainly on a more proactive basis, I think medical health officers working with schools, they're working with employers, and some of those measures are being put in by employers and workplaces and schools.
We know that the Saskatchewan Roughriders are one of two CFL teams that do not have vaccine requirements or negative COVID results for their fans to attend games. Have you recommended to the government that big gatherings, sporting events, concerts, that they do have proof of vaccination to attend?
So, I'm, obviously this is discussed within government, but I'm in touch on a daily basis with local medical health officers as well, including the city of Regina, who have been working throughout closely with the city of Regina and Mosaic Stadium and Rough Riders. And on the one hand, obviously, it was great to see, the start of the first three games, people out enjoying, 3 consecutive victories. But having said that, I think there is a role for mask use, especially in tight, congested areas of the stadium, like washrooms and some of the concession areas, shuttle buses, obviously. And so public health is working closely with the city of Regina and the association to see the feasibility of that. And then, I think initial assessments suggested that a majority of the intended people who would be participating would be vaccinated, but we have seen sporadic cases who did attend the games, and it required a public service announcement, and all the cases who were infectious while participating were unvaccinated. So I think that's another element that I think even a signal that it's really before the next game, get your first shot if you're not fully vaccinated. If you've had one shot, get your second shot. I think that can go a long way to increasing vaccine uptake, but certainly that's the largest gathering we have. But we're looking forward to hockey season starting, lots of other indoor activities, concert shows, and again, proof of vaccination is one mechanism, but an overall increase in vaccine rate, mask use, and those areas where you are kind of very congested, I think is important. As of course, we have to remember the Mosaic Stadium is outdoors, so in the stands maybe not so much of a problem, but other venues in the future in the fall will be indoors.
I'm curious though, why not encourage people who are to be vaccinated, and as a reward allow them to do fun things like go to concerts and football games and hockey games, because those are a privilege, not a right, instead of making everyone who's vaccinated mask through all of those games, when instead, I mean, if 90% are going to be vaccinated anyways, it doesn't really change anything, does it?
Well, I think there's two parts of this. One is that if most people are vaccinated, and then you may not have to wear a mask when you're sitting in a static position, because then, at the most you may, it's like sitting, you may, if everyone's forward facing, for example, the risk may be different than if you're crowded in a transit bus face to face. So I think it's important to be, and outdoors versus indoors, what's the ventilation like? So I think all three elements are at play. What's the vaccination rate? What's the local transmission rate? And then, depending on that, how effective are masks in that particular context. So like I said, an office environment or a workshop where same four people work with each other, less important. A crowded condition where you are with random strangers, tightly packed, like in a transit bus, more important. And for large events, certainly congested areas more important in terms of mask use. And vaccination, it helps in every location. Workplace outbreaks, we've seen primarily unvaccinated people, social events, birthday parties. So it's not a question of, at this point, I think we really want to avoid going to a situation where you can't meet across households, you can't have social gatherings in private or public spaces. But the way out of that is, vaccination, and then in certain situations, more consistent mask use.
Finally, I just want to ask you, as we are up against back to school, there are a lot of very anxious parents out there as they are about to send their unvaccinated children back to school. High school students, only about half of them are vaccinated. What's your advice to parents as they prepare for the unknown, really?
So, I think a couple of things. One is that, we have been saying consistently that, children 12 to older and older, their vaccination rate is 70. Let me see here, 12 to 17, 65% have taken first dose, 52% second dose. So that certainly there's room for improvement there. And that varies, it's high in the urban centers, lower in some of the rural and northern areas. And similarly, 18 to 29, 30 to 39, 40 to 49 vaccine uptake, first dose is 66 to 75% for those age groups, second dose 52 to 67%. So these are the parents of children. So obviously, if all household members, parents, siblings, grandparents are vaccinated, then children under 12 who can't be vaccinated are better protected. And same goes for school staff. And I really hope that school vaccination rates in school staff is much higher than what's in the community. So that is the first layer of protection. And then, of course, children under 11, in common areas, mask use in school buses and common areas. I think that will help, especially in parts of the province or in communities where transmission rates are high.
I guess I just want to be really clear before I let you go, because there is so much talk about vaccine passports across the country, that at this point, we are not going to be seeing vaccine passports in Saskatchewan.
Well, I have my proof of vaccination in my wallet all the time. I downloaded it from my Sask health record. And, I know several people who have to travel for work or leisure, either within the province to another province. And I've heard of some businesses in Saskatchewan showing great leadership, and universities requiring proof of vaccination, like for university attendance. So I think it is happening in sporadic ways in some sectors, and that is certainly bringing up vaccine uptake rates. Many of my colleagues have noticed an increase in university students lining up to get vaccines. So it does make a difference. It is important. So there's a document that all of us can easily access. There's some further work in terms of it being usable for international travel. That's happening in consultation with the federal government. But Saskatchewan is one of several provinces not requiring proof of vaccination as a provincial policy. Some provinces are, some have only recently announced. But I think whether it's done by sectors like universities who have shown great leadership, or by the province, I think the important thing is that that can increase uptake. But and again, people would say it's easy to say when uptake has slowed down. But I would still say, vaccine is easily and widely available. And, I think we should just, roll up our sleeve and get vaccinated. But I absolutely agree that whenever there's a requirement, for example, in university students, the uptake does go up.
Well, Dr. Shahab, thank you so much for your time and for your work.
Thank you very much.
Dr. Saqib Shahab is Saskatchewan's Chief Medical Health Officer.